Here today to speak on mental health innovation in the face of a pandemic is Maria O'Brien of Mindwise. Maria is a lifelong volunteer, a UN civil society partner, and Google Women Teachers Ambassador. She has a broad background in digital design and digital solutions consultancy, gathered over 15 years of practice. Currently, she serves as the lead digital designer at the Office of the Parliament of Trinidad and Tobago, co-director of Mindwise Project, a mental health non-profit focused on digital content creation and curation, and is also the founder and chief innovation officer of Design Change, a social change design firm selectively disrupting systems through targeted social innovation and sustainable development projects. Now, my friends, we are absolutely happy to have Ms. O'Brien here with us because we have to pay attention to our mental health. Sometimes we get so caught up in the day-to-day activities of adjusting and pivoting that we often do not take our own well-being into consideration. So it's about that time I leave the screen and allow Maria to address each and every one of us.
Hi, everyone. I'm Maria O'Brien. Thank you for that amazing introduction. That was awesome. Today, we are going to be talking about mental health innovation in a pandemic. And it's really a very important topic to me individually. I'm a person that lives with PTSD. I'm a survivor of another person's suicide. And mental health in the Caribbean, when I returned as a national, was something that was very shocking to me, the amount of work that was being done, but you couldn't access some of the amazing resources that were available to us. So I'm going to start by sharing my presentation. So as I was just amazingly introduced, my name is Maria Divina O'Brien, and I am a founder of Design Change. And in this particular case, I am the project lead of the Finecaretticom initiative. Finecaretticom is the national MHPSS crisis support directory of services for Trinidad and Tobago. Now, as we get into the concept of what MHPSS is, I wanted to explore what are disaster and emergency situations here in the Caribbean. And for some of you, as it was for me, a lot of this information was very new. Between 1970 and 2000, the Caribbean region recorded an average of 32.4 disasters per year. Let that number sink in. You know, it's actually a very high number, which caused a total of 226,000 fatalities, or approximately 7,500 deaths per year. What is the mental health and psychosocial support framework? For those of you who were like me, never heard the term MHPSS before, MHPSS stands for Mental Health and Psychosocial Support. And it is a growing global framework established by the Interagency Standing Committee for the United Nations for connecting people, networks, and organizations related to mental health and psychosocial support, both in emergency settings and in situations of chronic hardship, which is really something that we're focusing on in this presentation, is emergency settings and situations of chronic hardship. Since last year, since the COVID-19 pandemic started to rock our worlds literally, it's expanded rapidly from 22 countries in March of 2020 to 50 countries by November. And what that means is that this framework, which is designed to increase connectivity, we just had an amazing speech that mentioned interconnectivity, to increase the interconnectivity of mental health, pandemic, and disaster response, has been growing because of the impact of COVID-19, where we've had such a variety of mental health issues. So I thought I would go through some of the types of emergency and crisis situations that we've seen here in the Caribbean. So we had Hurricane Elsa just recently hit Barbados in 2021. We had the La Soufrière volcano eruption, which took place in St. Vincent and the Grenadines. Haiti, the magnitude 7 earthquake that took place in 2010, which is actually where I think a lot of disaster mitigation design has taken place since then, because it was such a massive human impact. And just recently, as within the last few years, we have Venezuelan migrants arriving via boat to Trinidad and Tobago, where we are having our own migrant population crisis. This takes us to the COVID-19 pandemic, where I actually grabbed these resources from a partner of mine, a diversity partner of mine. Her name is Janika John, and she did this innovation where they have been mapping COVID-19 pandemic outlooks in the Caribbean. And you can find this at carrycovidmap.com. And the number of active cases in the Caribbean is 143,358 with 12,296 deaths. Now, some of the regional mental health issues that have been observed from our partners, and our partners include PAHO, World Health Organization, Ministry of Health, Trinidad and Tobago, CANPA, and other international organizations that have been really looking at the data that's coming out of the COVID-19 pandemic. And these are just some of the areas that we noticed were really critical. So we have an increase in collective anxiety and stress, an increase in gender-based violence and domestic violence. There were noted rises in the cases of domestic violence in our region since COVID-19, an increase in substance and alcohol abuse and addiction, an increase in suicide, an increase in stress-related issues caused from the pandemic mandates in education, stay-at-home, and lockdowns. There's also an increase in unemployment and the need for public assistance. The mental health of teens and adolescents at home and at school are of particular interest to a lot of our partners because we're looking at a generation, they're calling it the lost generation of young people. Mental health workers, definitely mental health of workers in the workplace, that is all of us who have transitioned into a stay-at-home workplace. And then they have those of us who are continuing to work in their existing traditional workplaces while facing the threat of COVID-19. The mental health of mothers is also a category that has come up as a very critical category that requires support, as well as the mental health of those in bereavement or the loss of a loved one to COVID-19. As many of you may know, many of those who lose their loved ones to COVID-19 are not allowed to bury their dead in the way that they might desire. And not only that, their bereavement process is disabled, is crippled by the COVID-19 requirements. And of course, finally, and most certainly not least, fear and panic over vaccination requirements. Vaccine hesitancy in the Caribbean is very high. This brings us to our solution, Finecaretticom. And I really am very proud of the work that we started here. After discovering the MHPSS network, the Ministry of Health of Trinidad and Tobago invited Mindwise as a digital partner to come in and participate in the National Coordination Committee for MHPSS. While we were on that committee, we discovered that there was an opportunity for us to help disrupt the delivery of MHPSS services through this type of solution. So in response to the COVID-19 pandemic, together with regional and local leaders, and we're talking about really amazing group of change makers that were brought together by the Ministry of Health, really want to give them a shout out as very, very great connectors and bringing us together. And together we designed a platform to help the public find emergency and crisis mental health care and support resources. Problems that are being addressed by that are being faced by MHPSS in our region include poor access to mental health services, which of course is due to things like data accessibility, low connectivity, and in some cases, disability or illness, or in some cases, a lack of education about where these resources exist. Poor availability of data in the Caribbean mental health systems that can help inform regional policy and strategy. Vulnerabilities increased by the COVID-19 pandemic and other disasters and emergencies. So these three areas were really the areas that we were looking at to help improve with our solution. Our strategic partners have been the Ministry of Health of Trinidad and Tobago, PAHO, World Health Organization, Trinidad and Tobago, and our fellow MHPSS Technical Working Group members. These are just some of our partners here. As you can see, it includes multiple ministry, the police force, CANPA, the Red Cross. All of these partners have come together to not only inform the solution, but help us design better ways that the solution can help meet the public accessibility needs. My team I'm very proud of. My team includes Alyssa Khan, Elise Marcelin, Michael Lachman, and Aricha Dalal. And all of us are coming from developing countries that are facing mental health challenges. And we very passionately have come together to provide the solution. Some of the features of Finecaretticom include a helpline emergency listing that is constantly curated by all of the partners, a Spanish translation feature for Venezuelan immigrants, a search and filter function that is definitely something that is continuing to evolve as the complexity of some of the services continues to evolve. It is a mobile-friendly website. It has a feedback form loop, which is actually a new feature that we felt was very critical to the improvement of mental health service delivery. Very often you might see mental health service platforms or directory platforms, but we felt it was necessary on this platform that is being hosted by the partners in order for us to get feedback on the resources that the public are receiving and to know whether or not service providers were holding to their promise of accessibility and free services. Content zones, which include content zones from PAHO, World Health Organization, Ministry of Health, regional health authorities, the police. Each of these partners gave us critical content that supports specific emergency settings. Emergency settings that include the Venezuelan refugee crisis, gender-based violence or domestic violence, addiction and substance abuse, suicide prevention, children and adolescents, social services and support, the elderly, and frontline workers. And this list continues to grow as our work evolves. Mindwise Project was successful in signing an agreement with the National Ministry of Health of Trinidad and Tobago to be the technology provider for the MHPSS network of Trinidad and Tobago. And we were very proud of this achievement. Here in this picture, you will see Dr. Hazel Othello. She is an amazing change maker herself, and she's leading the mental health unit at the Ministry of Health, where they're doing some amazing work. At the launch of Finecaretticom, we had many diplomats who came together to really support this idea and to discuss how they hope it would continue to be implemented in other countries. And I'm getting to the end of the presentation where I have a big ask. Dr. Erica Wheeler, I thought we could go through one or two quotes that we've received as feedback. Dr. Erica Wheeler, who is PAHO representative for the region, said this launch of the directory is one that has been very much anticipated, and it is a major achievement and one that I hope will be replicated in other countries in the Caribbean. Bertrand Moses, who is the coordinator of child affairs, he's actually the one leading the charge of quite a lot of innovation in the children and adolescent services in our country. He said, Finecaretticom has been a timely historical solution to help our nation address critical challenges related to the pandemic. Based on my professional work and national reports, I have seen increases in child abuse, gender-based violence, and mental health challenges due partly to the pandemic. So that's our solution, and it was very positively received. It continues to grow, it continues to evolve, and what we have decided as Mindwise Project is to marry the MHPSS framework. We have made a long-term commitment to help disrupt the delivery of these services as much as we can with digital innovation and other types of support. Why are we doing this? And this is where you come in. The MHPSS framework needs support from our digital community and infrastructure. All of the leaders who are represented here at this conference, there's a reason why I was so eager when I saw that they were accepting applications for us to speak, because this work is so critical to the successful mitigation and recovery of our region, not only in disaster settings, but also in the governmental management and execution of the MHPSS framework. Mental health is the foundation of all social change. Until we heal our collective traumas and our collective wounds, I personally believe, as a UN civil society partner, that social change will always have this impediment if we don't include mental health as a strategic component to any type of disruptive or innovative system. As Mindwise Project, we saw an opportunity to disrupt the delivery system of the MHPSS framework with this key accessibility and management resource. And our nonprofit, we really focus on the accessibility to mental health resources as one of our key goals. We are currently working with regional MHPSS partners such as PAHO to develop and distribute an improved version of the platform to other countries in the region. We've already started discussion with 1 or 2 other countries. This new version of Finecaretticom will be called FindHelp, Crisis Support Directory, where we'll be connecting crisis with care, improving the accessibility and coordination of mental health and psychosocial support systems in crisis and emergency settings. Now, while I'm here to talk about MHPSS and to really introduce the idea of MHPSS framework to all of you here, I really thought it was an important opportunity to talk to you about the types of support that we can give those actors in the MHPSS framework. The first is data accessibility support for service providers. This would be agents who are actually out there. So much of the MHPSS work is being done voluntarily by civil society organizations. If we can support those civil society organizations better, connect them with resources, give them grants, give them opportunities for discounted technology, all of these things can really help them in the improvement of their service delivery. Funding and donations to MHPSS partners or MHPSS service providers is really important, especially because so much of it is being done voluntarily, and I can't underline that enough. I was amazed to discover how much of the mental health work in our region is being done by volunteer civil society partners. We need to help them by funding their critical service delivery. And because without them, a lot of our social structures and social support systems would fall apart. The support of national hotline operations is one that is particularly important, based on my observations with my work with the MHPSS thus far, and my conversations with national hotline providers as we do our verification every month. National hotline providers mostly are working overtime to support and be the digital and telecommunications frontline for mental health support. They handle so many different types of emergency situations where they have to involve the police, the fire service, and other types of emergency support to help people who are at risk. It is important for us to try and connect national hotlines with services or support or technology that can help them improve their operations, especially multi-line hotlines that have multiple volunteer call service receivers who are handling multiple lines and who really are doing most of this off of their private cell phones. We also need to help improve connectivity in rural areas. And we really believe that it's going to be something that will help increase the accessibility to any sort of innovation or service that can be offered to improve mental health in our countries. And lastly, get involved, whether it be through reaching out to me or reaching out to PAHO in your country. Please find out how you can support MHPSS in your country or in your region. It is very important, and I'm here today to advocate on our behalf. If you're interested in reaching out to me, you can email me at mindwisect@gmail.com or contact us via our website at mindwisect.org.
Thank you so much, Maria. Thank you so much for offering such critical information as we navigate this new digital age.